Hi, good afternoon or good evening. My name is Gary Garcia Siam, and this is my video diary for our 7 DHA 764 Health Systems course. Throughout the semester, we've researched and read up on a lot of various health systems across the world, including comparing them to the one in the United States. And it's been a great experience. I think it's been very eye-opening for me. It's been um, brought a lot of awareness and understanding as to why the health system in the United States is where it is right now, and why we haven't been able to, establish something like a universal healthcare system here in the U.S. But it was interesting to learn some of the other health systems across the world. Some that stood out to me were like Brazil's health system, how there is great satisfaction within the system there, and they offer insurance or healthcare to citizens and non-citizens of the country. So that's very um, sort of eye-opening for me, and it was great to learn that there's countries that offer that, in the world. Um, at the same time, it gave me an understanding as to why the U.S. Still has the system that we have currently have now. Considering if we were to establish a universal healthcare system, we'd have to consider the infrastructure, right? That we have enough hospitals, clinics, providers, nurses, etc., to support the expansion of a universal healthcare system to everyone in the United States, or at least citizens of the United States. And that would be another question, right? Do we offer universal healthcare to only U.S. citizens, non-citizens, etc.? Um, Another question there is, how do we fund such system? Do we provide mandatory taxes, mandatory payroll deductions, etc.? And how would the public take that in response to a universal healthcare approach, especially for individuals that already have insurance or already paying for premiums for a health insurance? How would they receive or respond to such a tax? And I don't think that it would be accepted with open arms. I do think that there would be some pushback from a good portion of the country. So in order to establish such a system, so it did give me understanding in that way. Where previously I didn't think that it was a simple task, right? But it did highlight some of the factors that go into establishing such a system. Another system that stood out to me was Nigeria's. So Nigeria has a system where they implemented a mandatory health insurance. But again, simply having a mandatory health care coverage doesn't mean that health outcomes are going to be good. You have to have the health insurance or the healthcare coverage, in addition to being able to provide great services and support um, such a such a healthcare coverage. Nigeria, for example, still encounters a lot of HIV numbers, um, malaria, and tuberculosis. So it's a great reminder that it's not a one sort of um, the solution to health outcomes is not a simple task. It involves a number of things, including healthcare coverage, access to healthcare, provider availability, and etc. Um, I think that in the future, I hope that the nation does head towards universal healthcare. Ideally, we do get a lot of um, migrants coming into the country, and ideally, I would like to see a nation that's providing healthcare coverage, just like Brazil does, to citizens and non-citizens of the country, and obviously with the infrastructure that's able to support that.